Dr. Madeleine Cunningham is going to be talking about unlocking neuropsychiatric disease in children. Tell me about Dr. Cunningham.
I've never had the pleasure of meeting Dr. Cunningham, so that'll be a treat this year, but I know of her work. She's a professor of microbiology and immunology at the University of Oklahoma. She's also the founding director of a diagnostic laboratory called Molecular Laboratory there in Oklahoma, and the chief scientific officer. So she shares with me a background in research and then taking it, translating that to diagnosis and treatment strategies for these diseases. So she's spent more than 32 years studying, doing basic research, translational research, and then developing diagnostic platforms looking at levels of autoimmune antibodies in the brain. So in autoimmunity, antibodies actually attack your cell. So the job of the immune system is to determine the difference between self and non-self and attack the invader with an appropriate force. So in children with these neuropsychiatric illnesses, they develop autoimmunity, likely because their immune system is not developed, doesn't know the distinction, because the infection or the dysregulation, the toxic dysregulation occurs before their immune systems have had the chance to develop. So this gives you a unique opportunity and Dr. Cunningham will talk to us about, unlocking that, really unlocking where the pressure points are in age and what the biomarkers might be, so that clinicians can see this in a baby, an infant, well before it manifests itself in the most devastating forms of the illness, which are known as PANS and PANDAS. In these neuropsychiatric, pediatric acquired neuropsychiatric syndromes associated with various pathogens, strep in the PANDAS situation, but now with the PANS, it's many different infectious agents or dysregulated pathways that Dr. Cunningham will talk about. So to have the practitioners, as we said at the opening, the whole value of this year's conference is to teach people from preventing the most devastating forms of the disease from progressing, from developing, by teaching practitioners to recognize them and treat as early as possible, because early detection is the key to really every chronic disease. Early intervention and early detection, and that's what this year's conference will teach practitioners. And I'm delighted to meet Dr. Cunningham and share our mutual passions in this regard.